I just want to let you know that I feel very, very honored, first of all, to be sitting next to this man, because not only is he a renowned physician and healer, he's also my doctor and was instrumental in the fact that I have a 19-year-old son. So I feel incredibly blessed on a multiplicity of levels to know him. He's helped so many of my friends, so many of my students, and his practice is one of the most prolific in Los Angeles when it comes to fertility and fertility support. I'm just going to go through a couple of his honorarium biography things because it's important. He's earned a lot. Dr. Daoshing has earned extraordinary credentials from the medical communities of both East and West, but it's his patients who define him best. Dr. Dao, as he's known, is the 38th generation in a family lineage of Chinese medical doctors. He's well known and respected in his field. He's the founder of Yosan University of Chinese Medicine, holds 2 doctorates in Oriental Medicine, and was awarded the recipient of the American Fertility Association's Dr. Joyce Vargas Visionary Award in 2009. He's a member, yes, thank you. He's a member of the American Society for Reproductive Medicine, Pacific Coast Reproductive Society, American Society for Nutrition, and the American Association of Oriental Medicine. He has co-authored the book, The Tao of Fertility. If you don't have it, please get it today. It's an extraordinary guide toward holistic approach toward fertility from the Chinese perspective. And he wrote that with one of his students and patients. And he's been featured on the NBC Today Show, Conceive Magazine, Conceive on Air, Women to Women, Donnie and Marie, The Hour Show, and so many more. Dr. Dao came to my awareness when my girlfriend was having difficulty conceiving. She wasn't ovulating. She didn't have a cycle. And she found him through a friend of hers. And she went on to conceive naturally and give birth to my godson. And I had been trying to conceive for about 3 years, and I thought, well, something's not working. So I think maybe I should go see him too. So I called Dr. Dao up, and I made an appointment. He's a very busy man, so the appointment wasn't right away. It was like in a couple of weeks' time. And the Sunday before the Tuesday appointment that I had with him, I was at the movies, and all of a sudden I realized my breasts were really tender. And on the way home, I just had an intuition, and I went home and I took a pregnancy test, and it came back positive. So Monday morning rolls around, and I call him up, and I said, "Damn, you're good." I said, "I didn't even have to come see you when I'm pregnant. Like, how do you do that?" So I said, "Do I still need to come? I mean, you know, I'm already pregnant." And he said, "Yes, you should probably come in. Just let me check on things." Well, I came into his office and found out that it was a miracle I was pregnant because I had blood deficiency and numerous amounts of imbalances in my body. And he said, "I think we should work together to make sure you don't lose this pregnancy." And sure enough, 3 months later, I was well on my way to a very healthy pregnancy and have a beautiful, healthy son. So he has, and this is one story among thousands of women in Los Angeles. I wanted to open it up today by asking, how many of you here in this room are familiar with acupuncture? How many of you have experienced acupuncture? Okay, great. That will help us talk to you in a little bit more in-depth way. So how, Dr. Dao, does acupuncture actually help with fertility?
Well, can you hear me well? Okay. Acupuncture has been around for probably documented for at least about 2,500 to 3,000 years. You probably heard of tiny little needles, not injection needles. So any one of you who haven't had acupuncture really need to realize that the needle is literally hair fine. It's very thin and it really doesn't hurt. And when the needles are inserted in different spots of the body, we call points. And they solicit certain responses in your body. It could be a neurological, it could be an endocrine hormonal response. But it depends on what you're trying to treat. In fertility situation, we might be, and it depends on what stage of your cycle, we might be soliciting and stimulating or working with your ovaries to ovulate better, for example. We might be working with your linings, working with your uterus for that receptivity. We might be working in different times, such as period time. We might be helping the period to flow better so that so everything discharged nicely and completely. Acupuncture can be used in different different ways during a whole menstrual cycle. And we usually frequently combine it with herbal medicine in reproductive medicine treatments.
So TCM is both acupuncture and herbs. What role does meditative practice serve with this?
Meditation is a very important key, as you know, that trying to get pregnant is a very strenuous, shall we say, very stressful process. And a lot of times I advise my patient to have moments in your day, moments of your life on an everyday basis to really participate in not just meditation, but meditative exercises. Things like yoga, things like Daoshing, things like Tai Chi, things like Qigong, that can really help you to really center your mind and center your spirit and relax your body, because that's going to help you to get pregnant. It's a very catch-22. The more you want to get pregnant, sometimes the more stressful you get. And so a lot of times that makes it even more difficult. So we always say that infertility causes infertility. So there's a lot of truth to that. So a lot of times you have to really compartmentalize your life in that sense and take on a good healing partner, take on a good acupuncturist or a good doctor who might be a good partner with you to go through this journey. This journey has a lot of ups and downs with your emotions, and a lot of times your partner, your doctor, will be the one that will be really helpful for you. They could be somebody that you can rely on. They could be somebody that can hold your hands and be objective and help you to go through and see things much more clearly for you.
In your book, I know you cover nutrition. What role do you feel nutrition has with fertility?
Nutrition is a very important role. If you look at Asia, it's very different nutrition-wise here than in Asia. When I was working in Asia, a lot of times you're dealing with people who actually don't eat nutritiously enough. So you might have people who has a lot of anemia issues. You might have people who have a lot of deficiency issues. They have a lot of cold hands and cold feet. They're usually emaciated. They're not very, they are not obese. There's very little obesity in Asia at that time, 1983, 87. So at that time, so as we are working with patients, we're asking them to eat a lot more meat, more vegetables, more meats, and more proteins. Since it's a non-dairy country, I have to literally get them to drink some milk and do all sorts of things to help them. In this country, it's a little bit different. We tend to have more of the obese issues or overweight issues, or what we call overnutrition issues. Sometimes we eat too much. Sometimes we eat too much of the wrong foods. And frequently sweets is one of the biggest things that a lot of people that go toward. And so we would ask our patient to really cut back on sweets. Part of the sweets issue is not just eating sweets, is that the amount of stomach you have to eat sweets, you neglect the other foods that you might be taking in that might be better nutrition for you. So a lot of time I'm a proponent for people to eat a very balanced diet. Okay, unless you have real strong allergy to gluten or allergy to certain things, it's very important to have a very balanced diet. So we tend to talk to the patient and look at what they've been eating, cut down the sweets, up the protein or up the vegetables or the fruits, and eat 3 meals a day. A lot of people don't eat breakfast in this country. I don't know why. Breakfast is one of the most enjoyable meal. So you should really have breakfast. You got to, get up, eat breakfast. Don't just run out of the house. It's not really good for you. And some people even worse. They not just don't eat breakfast, they drink coffee on top of it on an empty stomach. So that's not always very nutritious, and that's not the way you want to start your day with your heart beating so fast. So what you want to do is really look at it's not just what you eat, it's also how you eat it. making sure that you have 3 meals a day, making sure you're on a regular basis. Your body likes that. Your body likes that a lot. All your hormones, all your blood sugar becomes much more stable when you eat on a regular basis.
So one of the things that I've come to learn through your work is that traditional Chinese medicine is really about balance. It's really about finding that balance within the body, and so that's what you're speaking to. When someone comes to you and they're starting to do acupressure and acupuncture and infrared sauna and monitoring their nutrition and their herbs, how are they able to actually know that it's working for them?
This is a question that most patients will ask their acupuncturist. One of the things that you want to see is you really want to see a certain objective symptoms and signs that's improving. So a lot of time when we do a workup, there may be issues. For example, their ovarian hormone may not be as strong. Their FSH may be rising. Their estrogen may not be in the right level in a certain time of the cycle. Their AMH level might be very low. Their thyroid function might be weak. That's just the clinical signs. And then you might be dealing with people who might have irregular menstruation, their ovulation's not on time, or their periods or their ovulation's a little too early, or their period become lighter, and other symptoms, headaches, for example. So what we do is that we look at the whole picture of the whole menstrual cycle. And usually when I sit down with patients, I tell them what I'm expecting. For example, I like to see you have more vaginal discharge during your ovulation. Sometimes that becomes drier as you get older, for example. So, for example, I would tell the patient that, I would like to see you ovulate around a certain time. Maybe before it's too early, maybe it was too late. Let's see what we can do to move toward 14th day of the cycle. Look at your period. Sometimes your period's too light. We would like to see your period gets a little bit heavier. Sometimes the period's not bright enough. Sometimes it's very dark. So we like to see the color of that period improves. Your body does tell you a lot. A lot of symptoms really tell you how you're doing. Obviously, this race, you only win by having a gold medal. And that gold medal is getting pregnant. So you don't get praise, or you don't get frequent miles when you get silver and bronze medal. So in this situation, before you get pregnant, these are some of the symptoms and signs that I like to see. And usually I would tell the patient that a certain period of time to achieve a certain goal. That's what we like to see.
And how do you manage their expectations? Because there is that time pressure of how long it might take them.
Each individual patients are different, and I think it really depends on the situation. So typically when a patient comes to see me, or even any acupuncturist who specialize in fertility, is that we usually tell the patient what we're expecting, what kind of symptoms and signs we like to see, and when do we expect a patient to be pregnant by a certain time. And if not, we usually start bringing Western medicine. And sometimes I have a patient that come and see me. Nowadays, a lot of times, a lot of people hasn't really started insemination or IVF situation. So a lot of time, I would give them a certain period of time. So let's try Chinese medicine first for anywhere from 3 to 6 months. If a woman is 38 or above, or they're reaching 40s, then we don't have much time. So maybe our treatment's only going to be around 6 months or 5 months before you start doing insemination IVF. So it really depends on the situation. There's some women, for example, that comes in and their ovulation is really poor. They really have very poor hormonal profile where their AMH level is quite low, or their ovarian reserves are diminishing, even though they are young. In those situations, then we have to get going. And this is a time where we do throw the kitchen sink into a patient. So we say, okay, you got to do both at the same time. We don't have much time to waste. So it all really depends on the individual. But usually what we do is the first visit, you have to have a plan. And I always tell my patients the most important thing about reducing stress is really to have a plan. Work toward a plan, because once you have a plan, you can really see, okay, this is where we're going, this is what we'd like to reach, this is what we'd like to have, and that really help to really to have a kind of guidepost to work toward.
And you mentioned it, sometimes you have to throw the kitchen sink. How does maternal age affect fertility, and how does Chinese medicine look at maternal age?
The maternal age is still the number one predictor for fertility for having a baby. Older you are, the harder it gets. My oldest patient I've helped to get pregnant is about 46 and 3/4, and that's one. So as you can see, it's not very easy. I have a few 45s, and these are all natural pregnancy and having children. But it's not a lot. It's not like everybody does that. It's a few in between. So I don't want to give you a wrong impression that it's going to be easy for you to get pregnant in the 40s. It's not easy to get pregnant in the 40s. So age is still a really big predominant factor. So a lot of times, if I can, I have people who are early 30s and they think, well, they're going to try when they get to 36 or 37. I say, don't even think about it. You got to get started. It's a very good story. I had a patient who had very severe endometriosis, who has pelvic pain almost every day of her life. And she was 25 when I saw her the first visit. And after a few months evaluating and treating her and really realized how severe her pelvic pain is. I mean, she's on continuous birth control pill, and even that doesn't really cut the pain. And it was a combination of continuous birth control pill with acupuncture with Chinese herbs that really shut it down. So I told her basically, honey, you got to get pregnant before 30. This is what I told her. Because, you know, you have endometriosis. This is a very severe business. You don't get pregnant before 30. I don't know how your ovary is going to work, because endometriosis really decreases your ovarian quality. So in her situation, for example, she actually went out and start dating, and I told her, you got to get married in about 2 years. No pressure at all. But if you couldn't at least start dating today, that's what I told her. And you know, I say, now, you know, you don't have any more pelvic pain, so you better date. So she had an excuse first. So I got pelvic pain, I can't date. No, you got to go now. So anyway, she dated and she found somebody and she got married after 2 years, and we came off the birth control pill, and immediately, because the pain will come back really quick. So we actually were able to, we were very fortunate. She got pregnant literally second cycle and have a first child. And immediately, once she had a child, put back on the birth control pill, pain come right back. And then we did a whole thing. She had second child, third child. So she had 3 children before age 35. So that was a wonderful story, because the third child, she had 2 miscarriages before she had the third child. Just to give you some idea, and she was like probably somewhere around 33, 34, around that time. She's still young. So give you some idea of what it does. So age is a big, big factor. If I would do it again, I would probably go to high school and teach our women about not contraception. I think that's a little weak. I mean, we're teaching them about contraception. We really need to teach them about their fertility journey. Telling them, yes, if at high school you look at a guy the wrong way, you're going to get pregnant. Okay, absolutely. Okay, but don't teach them just about that, but really teach them about what the fertility journey is. Your fertility peak, when your fertility peak, the peak is around 24, 25. You start to go to 30s, your fertility drop 50%. Right off the back when you get to 30. So you really want to be conscientious about that. There's certain things you can wait. Fertility is not something that you want to wait too long.
And that's absolutely correct. And one of the things that the American Fertility Association, that I'm the national spokesperson, they're starting to realize that that's really the work that we have to do, is in education around fertility and timelines. You mentioned miscarriage. I want to talk about that and how women over 40 have a tendency to have recurrent miscarriage, and how do you work with the grief and loss cycle with them?
The worst case I ever had was somebody who had 10 miscarriages that show up in my office. I don't know how a woman can handle that. I think any woman who has 4 or 5 miscarriages, they basically throw in the towel. That's it for them emotionally. It was just too hard to take. We won't even talk about physically how hard that is. But I remember this woman very well, and I'll start with that story. And she had 10 miscarriages. She's about 41 or 40 years old around that time when she saw me. And it's been a long journey. She started when she's in her early 30s. So we were able to help her to get pregnant again after 8 months of our treatment. And she miscarried, unfortunately, at 12th week. At that point, I say, well, that's throwing the towel. That's 11th miscarriage. I'm in pain for her. I feel the pain. I'm in pain for her. And she comes into the next visit. She was all happy. I say, why are you happy? Because I'm not happy. Why are you happy? She said, this is great. I've never miscarried at 12th week. All my miscarriages at 6th or 7th or 8th week. This is the best I ever have. I see the end in sight. I'm going like, wow. If you're this much so positive, I don't know if I can be so negative. So, I say, okay, let's try one more time, and let's work really hard. And we were able to help her to get pregnant again, just right shy before age 42, and she actually have a healthy child. And then that was amazing story. But miscarriage it's a very difficult issue in the sense is that it's emotionally draining. Okay, it really takes a lot out of you. And it's very easy for a doctor to say, okay, don't worry, let's just get prepared and get pregnant again. And a lot of time, it takes some time for the patient to really turn around, get ready, and take the courage and do it again. The problem that I see is that it's a very push and pull kind of situation, because there are times where emotionally you need time to get back, but that's the time you don't have also at the same time. So it's very critical, especially in that late 30s and early 40s. And so a lot of times I always tell the patient, I say, okay, go take a vacation really quick. Go to Hawaii, go to Fiji, go someplace no one's around. Have fun, enjoy, but don't wait too long. Come back, and if you really want to try it again, let's work on it soon, okay? Don't wait too long. Unfortunately, some people take them literally 6 months for them to say, okay, I'm ready again. And that sometimes wasted a lot of time. So there's what we do in treatment of miscarriages is that we look ahead. A lot of times, once you're pregnant, the dollar bills are already minted, so to speak. So it's basically, there's not much you can do a lot of times. You want to really start working on preventing miscarriage before you get pregnant. Okay, so the work is before pregnancy. So that's what we're trying to do with a lot of people that we treat for recurrent miscarriages. And that's how we really can get that the live birth rate up instead of just the pregnancy rate. Yeah.
I don't know if you guys can hear this. I'm sure you can see it and feel it. But this is why Dr. Dao is so impactful. Because as soon as you walk in that room, you feel you have a partner. You don't feel like you're alone. And the way he speaks to you is as a partner. And it's we. It's not you need to. It's we are going to do this. And then we are going to do that. And there's this sense of feeling like you're being held emotionally, physically, and spiritually by a physician. And it's a rare experience, I think, traditionally to feel that way. You're not being pushed pills. You're actually being held to your highest good, whether you want to stop or continue. You have someone who's there looking out for your best interest. And that leads me to my next question is, when do you know when it's time to stop? Because there is the emotional toll, there is the financial toll, there is the mental and relationship toll. So how do you know when to tell a patient, or can you sense it in them when they can't even pull the plug themselves?
I think this has a lot to do with a sense of your spiritual journey. I think in the sense of what you really want out of this whole experience. Is motherhood you're looking for? Is having a child? There's many different ways to have a child. There are times where that genetically may not be possible, but there are donor possibilities. There are donor egg possibility, or even donor embryo possibility. There are a lot of possibilities around. And sometimes you have to open eyes to it when you're challenging so hard, when your body just couldn't do it. It's really interesting how sometimes a patient who I told them, well, do you think we should go to donor egg? Now you're 45 and your periods are dwindling. And they say, okay, finally they do it. And they say, how come you don't tell me earlier? I say, well, I couldn't convince you earlier. So a lot of times is that you can't, the journey, there's a certain sense of where you are supposed to be at your journey. You cannot force it. You cannot force that process. But it's very important to be open-minded, to keep your eyes open, to really go seek out that information. You never know until when you learn more about it. Okay, so a lot of time I ask my patient that at a time where donor egg might be a possibility or might be necessary, I tell my patient, I'd like you to just explore it. Go talk to people. I'm going to give you some resources for you to talk to people who have done it. And they can give you some idea what's like, for example. And a lot of times they're so much happier. They're grateful. I get thank you cards. Say, Dao, I'm really thankful that I did this. And so a lot of times, if we need to do it, we should do it. And really look at, and a lot of times it has a lot to do with opening your mind and your soul to what's possible. And so that's important.
I like to say if you want to be a parent, you will be. You just don't know the how or the when.
Yes, sleepless nights and all that, yes. Yes.
So we talked about this on the phone about who's in the driver's seat when it comes to fertility and the difference between men and women on the fertility journey and what that impact is on the relationship. Can you speak to the male aspect a little bit?
Well, man has a lot to do with it too. First of all, just talk about male fertility, for example. Man is not just taking a sperm analysis, semen analysis, and that's it. If he has 200-300 million sperms, then he feel like he's up here. He's the best guy in the world. Fine, that's fine. But that doesn't always explain everything. That doesn't always mean that the sperm quality is the best. So sometimes we want to take a look at the whole parameter. We want to look at the quality, the morphology of the sperm. Sometimes we actually want to take a look at the DNA fragmentation. We want to actually look at the genetic part of that sperm and to see how that's functioning. But besides that, I think man has a very unique role, and that role is to provide important, strong anchoring and support to your partner. And nowadays, we have a family that is basically same-sex marriages or couples. So a lot of times, regardless of that, I think we can talk about using the term partner. I think it's important to be a very strong partner and generous with allowing the emotions to come in and emotion to go out and allow. And I think the biggest thing is listening. The key is listen and be there for your spouse. And I think that's very, very important.
That's a good point. I want to talk just a little bit about the cost, because there's many different costs with infertility. There's the financial, there's the mental, there's the emotional, there's the physical, and then kind of how you weigh those out. Obviously, money is an issue a lot of times.
I think the important thing about cost is to really look at, a lot of times when I see a patient, I examine their spirit. I look at, is how much I call it spiritual capital do you have? How much strength do you have? It's not just the money strength. Money is equally, financial is very important. But do you have the spiritual strength to carry through this process? And a lot of times I help the patient, I talk to the patient, and I communicate with the patient, and I guide them through the whole process. And sometimes the patient need to stop early because I might see a patient who had 11 IVFs already and who have done so much in stimulation where their body just, it couldn't do it anymore, and it's becoming, I don't want to use the word trashed. I mean, you get to a point where your body just tired and not functioning as well anymore, and you need to rejuvenate. So in those situations, I might be in a totally different mode, but the patient is still trying to get pregnant. Their body is saying, no, I'm tired, I can't do it anymore. Do something else. And the body will keep on giving you all these symptoms. So this is a time where I talk to the patient, say, listen, we got to listen to your body. Let's see what we can do to replenish and rejuvenate the body. And so that cost is important to evaluate.
To nourish and to make it strong so that it can be a healthy place for a baby to grow. Thank you so much. I would like to open it up to Q&A so that if you have any questions of Dr. Dao, you can ask them now so that the folks at home can also benefit by your curiosity.
Anyone have a question? I can give you the mic. Any questions in the audience? Yes? Great. 1 second. Give you the mic.
It's a question about periods and how they end up lighter sometimes. Some people who have blood conditions, you know, it just changes throughout the years, and what it means if you have a lighter period, even though it's very red and consistency, and what that really means.
It means a lot, actually. As you get older, normally, if you don't have fibroid or polyp issues, a lot of time, frequently, your period is getting lighter, dwindling. A lot of times, this has a lot to do with the formation of the endometrium lining in your uterus. And that formation of the endometrium has a lot to do with your hormone levels. And your hormone level has a lot to do with your ovarian reserve. So it's kind of, there's a domino effect, cascade of events that goes back to your ovaries, goes back to your whole reproductive system. Besides that, also your metabolism, your constitution also plays a role, your history, your family history or period also plays a role. So a lot of times we will take a look at that. Anemia, patient who has anemia can also play a role. But it is helpful to really look at, like for example, if there's a sudden loss or there's a sudden decrease, we don't really like that. We like to have seen more like a gradual decrease as you get older. That's more normal. That's more normal. But still, nevertheless, we're trying to see what we can do to improve that flow, to improve at least the color, the quality of it. Sometimes as you get older, all of a sudden you no longer have clots and you're bleeding light. A lot of times we actually do like to have just a little bit more. We like to have a little bit more, but not creating fibroid issues or not creating big issue for the uterus. But we like to improve that hormone status in a patient. So we do seek for ways to try to improve that flow if we are seeing a decreasing flow.
Any other questions from the audience? Yes. Great.
Thank you for sharing all this. My question's really around like timeline to start treatments with you. You know, we're thinking about having a baby. We're looking at donor options right now. We're thinking about doing IUI. Knowing that we still have a timeline of our own to make those decisions and get that going, do we come see you now or do we wait until we start trying? Or what are your thoughts on when we start seeking TCM?
I think the very first thing I always look for is what is your final goal. I think it's very simply to put it, your final goal is not about pregnancy. Pregnancy is just one of the process. I think the final goal is having a healthy baby. Okay, and having a healthy body to be able to handle and be a caretaker for your baby, okay, be a mother for your baby. So a lot of times we start to see the patient much earlier, start a few months before, and really get your health in a good place. And take a look at your habits, take a look at, and this is a good time if you think about it. You're having an opportunity, you know, becoming a mother is an opportunity to change, to do things so that you can really look at your lifestyle, look at your eating habits, look at your exercise, look at your life, look at your work stress, look at all the different things. Say, hey, do I need to make some adjustment here? Sometimes the adjustment's not large adjustment. Sometimes just a minute adjustments. Like stop smoking would be a nice time to do it. You know, smoking 2-3 cigarettes is not good enough. I always have this argument with my patients. Oh, I can't quit. Can I just smoke 2? I have to negotiate with them. How about 1.5? How about 1? So a lot of times we go into this negotiation. But still, I mean, these little things, they might be no big deal in one day. But think about 100 days. Think about the next 30 years and 40 years being a mother. It makes a huge impact. And so lifestyle is good, and also your body, your constitution. Are you feeling strong? Are you in a good primal state of health? I'm not just talking about reproductive health in general. Because a lot of times pregnancy is a stress situation. How is your body going to handle that stress situation? You know, I don't want you to come out and having postpartum depression. I don't want you to come out I don't want you to have preterm labors. I want to look ahead and say, okay, and you can actually see some of the patient. This patient's probably going to have gestational diabetes. This patient probably going to have preterm labor. You can actually see some of them ahead. So what you're trying to do is address it already before you're pregnant. So that way that you don't have to deal with some of these issues when you come close to that time.
Question right here.
Not necessarily a question, but I just wanted to say a thank you to Dr. Dow, because 12 years ago I was his patient, but I was also a student of his school. And I was diagnosed then with early menopause. And you looked me in the eye and you said, Danica, if your body is going to early menopause, it will do that. And you will let the stress of it take you there that much sooner. And if you hadn't said that, I wouldn't have pushed the brakes and slowed my life down and looked at things so that 5 years later I could conceive on the first try. So thank you. What you're saying is so important for everybody to hear.
Thank you, Danica, for being here. Thank you.
Any
Also
other
wanna-
questions? Oh, right here.
Hi, Dr. Dow. So I have a question with regards to freezing eggs. A lot of clients or friends, they're approaching 35, and lots of people say, you don't have a partner or you're not married yet, go freeze your eggs. So I wanted to see what you thought about freezing eggs, what age, how does TCM apply to that?
Well, two persons sits next to you is Dr. Hal Denzer. You should go ask him. He'll probably give you more succinct answers. But we really like to freeze eggs below the age of 35 as possible. The younger you freeze the eggs, the better. The freezing technology has improved with vitrification and other things that we do. You can really make it better now, but still, the overall age does still play a factor. So you really want to do it soon and early. I usually advise my patient, try not to do it over the age of 35 if you can help it. If you can help it, if you do have that opportunity, do it before age 35. I hope that answered your question. Yes.
Do we have any other questions from the audience?
Health answer, did I say it right? Was that correct?
You guys
Okay,
have a
good.
Hi, Dr. Dow. We were doing acupuncture for about 6 months and did our first IUI, which was unsuccessful, and it put a lot of stress. And we decided we needed to take a break emotionally for a relationship and a lot of stuff. And we've taken a 6-month break from acupuncture. We want to get started again. Is it now we're starting back from day one, or has that 6 months that we did prior, is it still beneficial? I know my FSH level was really high. It went from 21 down to 10 from acupuncture. Will we have to start again? I mean, and I'm older. I'm going to be 41 in a couple months. So I just don't know what the process would be for somebody like me who's done it and I have a low ovarian reserve. If we should start again, or if we should just jump into IVF, or what? Any thoughts or recommendations you could give?
Well, answer backward. Jumping into IVF, even an IVF doctor will tell you that ideally you really want to get a good cycle where your FSH level is lower than possible, okay? Not saying that higher the level can get you success, but it's less of a success. So we still like to see a good number. So some of the IVF doctors, a lot of time they're not going to stimulate you if your FSH is above 15. So a lot of times that you really want to still head back to your acupuncturist if you can. You have to recognize is that when you're 41, yes, you're racing against time. There's no doubt about it. It's factual. So what you've done, whatever acupuncture you have done, might still be helpful for you, but you're not getting younger. So a lot of times you really want to stay on top of your treatment, continue with your treatment, go back, make some goals, see if you can get, and I wouldn't wait for too long this time around, maybe wait for only about maybe 2 or 3 months the most, see if you can get our FSH down as quickly as possible, get the AMH level up, so that and you really need to, at this age, you need to throw the kitchen sink in, okay? So This is where you have to do IVF. This is where if you want to push it, you have to push hard because age is not on your side. So that's what you have to do.
Really quickly, would you just speak to acupuncture and IVF combined and how it has helped IVF implantation and some of those studies?
Yeah, I think this is probably about, I would probably say about 20 years ago now, probably 1987. I was probably the lone ranger in the States treating a lot of fertility patients with acupuncture. And I think I saw a patient from Richard Mars. There was a patient who went through, at that old days where you were using much higher dosage of drugs. And one of the patient started to go into menopause, kind of early menopause. I think she was 42 at that time. So her ovulation was completely shut down. So she's not getting her period. She's having hot flushes. And I was very lucky, very fortunate, was able to reverse that process. And she was able to get her ovulation back and start getting period. And she actually got pregnant naturally. But the issue here is that the acupuncture can be extremely helpful in stimulating ovarian function. So a lot of times is that when you do IVF, you can combine it together quite nicely. There's so much study now that shows that acupuncture can be really helpful. And you already know probably around the transfer. But what you don't know is that acupuncture can also reduce the amount of drug that you use, actually, because you become more sensitive to the medications, and that actually you may not need as much drugs as you stimulate. Obviously, if you're older, your body might be more tired, so therefore it may not happen that way, but a lot of times we do see that clinically.
Any other questions?
Hold on for the mic so that we can have our audience at home hear you.
Thanks. The ovulation predictor kits, often many of us women use them, and I find that you sometimes get positives throughout the month. Your LH surges, there's just multiple LH surges. You know, I am with Dr. Morrow, so I go in and I check when I am actually ovulating. But why does that happen for some women, that you get these up and down surges?
Well, a lot of times that is, and especially when you get into the early 40s or late 30s, a lot of times your cycles start to having a little erratic behaviors. So sometimes you're going to get a little bit more LH surges, and it doesn't mean that you're ovulating. So a lot of times when what we like to do is that when these kind of things are happening, we would like to do a combination looking at basal temperature chart at the same time using the ovulation stick. Because if you're just having a false LH surge, that basal temperature chart may rise a little, it'll just go right down. So it doesn't really, it shows, it'll prove that that's not a real ovulation. So that's the way we would try to discern it.
I think we need to wrap up now, so if you wanted to close and if you want to say anything else, or I can take us out.
No, that's fine. I just want to thank all of you for coming today. There is a wealth of resources in this building, and the majority of the people who are here today not only give of their expertise, but they truly are your partners in this journey. And many of us have actually gone through what you're going through now, and our hearts are open and know what you're going through. And so I just want to say there are resources, and please know that reaching out is the best way to move forward, because sitting and not having a community of support, whether it's your doctor or a help group, a Resolve support group, the AFA, a yoga class, whatever you can do to reach out so that you don't feel alone and that you're in a community that holds you through this process, the healthier the outcome will be for you, regardless of the physical outcome. So I just want to say thank you for being here. That's the first step along the way. You've already done that for yourself, so I want to congratulate you. Thank you for coming.
Thank you all.
And thank you for the privilege. Thank you.